If you're over 70 and you've been told that declining physical vitality is just something you have to accept as part of aging, I need you to stop and hear this. That's simply not true. I work with men in their 70s and even their 80s who have successfully restored function, energy, and confidence, not through some miracle cure or expensive gimmick, but through understanding what their bodies genuinely need and providing it consistently. Age is not a death sentence for your vitality. And today, I'm showing you exactly how men over 70 are turning things around, even after years of feeling like they've lost something important. Before we go any further, hit that like button right now. And drop a comment telling me where you're watching from, because what I'm about to share could fundamentally change how you think about what's still possible at your age. Here's what most men over 70 have been told by doctors, by society, by well-meaning family members. You're just too old now. This is normal. You need to accept it and move on. And here's what I'm telling you after 5 years as a urologist, working directly with older men. That's one of the most damaging, defeatist messages in all of medicine. My name is Dr. Jocelyn, and I've worked with countless men over 70 who were told they were past the point where anything could help. And I've watched those same men restore function, energy, and quality of life through a combination of smart medical interventions, intentional lifestyle changes, and most importantly, refusing to accept decline as inevitable just because of a number. The biggest myth perpetuated in our culture is that age alone eliminates the possibility of healthy function. That's not how human biology actually works. Yes, things change as you age. That's undeniable. Testosterone levels decline gradually. Blood vessels become somewhat less elastic. Recovery takes a bit longer. But none of these changes mean that function is impossible. They just mean you need to address the underlying factors more intentionally and strategically than you did at 50. Here's the truth I see in my practice constantly. Men over 70 who successfully restore function and vitality are consistently doing 3 things right. Number 1, they're optimizing their cardiovascular health because physical function is fundamentally about healthy blood flow throughout your body. Number 2, they're addressing hormonal balance, not just testosterone, but also thyroid function and overall metabolic health. Number 3, they're combining medical tools with lifestyle optimization, not relying solely on pills, but also not rejecting medical help out of pride or stubbornness. The men who succeed aren't just lucky. They're strategic and consistent. In my 5 years of practice, I've seen 75-year-old men who hadn't experienced healthy function in years restore it completely. I've seen 80-year-old men improve their energy, their physical strength, and their overall vitality in ways that genuinely shocked their adult children and grandchildren. So here's what we're doing today. I'm walking you through 5 key strategies that men over 70 are actually using right now to restore function and vitality. These aren't theoretical ideas or wishful thinking. They're practical, proven approaches that work when applied consistently. And if you stay with me until the very end, I'm revealing the one critical mindset shift that separates the men who succeed from the men who give up, and it has absolutely nothing to do with your physical health or medical history. Now, let me walk you through the 5 strategies that men over 70 are using to get their performance and vitality back. And if you're serious about reclaiming what you thought was permanently lost, hit that subscribe button right now because we're going deep into what actually works, and you'll want access to this information. Number 5. Optimize cardiovascular health first. Everything else depends on this foundation. Here's what most men don't fully understand. At 70 and beyond, physical function is almost entirely about cardiovascular health. Your heart, your blood vessels, your circulation, these form the absolute foundation. Here's the biology, and this is crucial. Healthy function requires adequate, consistent blood flow to specific tissues. If your blood vessels are stiff, chronically inflamed, or partially blocked by plaque buildup, no amount of testosterone or medication will fully compensate for that underlying problem. The men over 70 who successfully restore function always start here: comprehensive cardiovascular optimization. This means actively managing several key factors, keeping blood pressure well controlled, ideally around 120/80 or lower, controlling cholesterol levels, particularly LDL cholesterol and triglycerides, reducing systemic inflammation, which can be measured through markers like C-reactive protein, maintaining healthy blood sugar levels, fasting glucose under 100, hemoglobin A1C under 5.7, Clinical studies consistently demonstrate that men with well-controlled cardiovascular risk factors maintain significantly better physical function well into their 70s and 80s compared to men with poorly controlled risk factors, even when their testosterone levels are nearly identical. Emotionally, knowing that you can still genuinely improve function by addressing cardiovascular health is deeply empowering. It's something you have significant control over through your daily choices. Practically speaking, this means eating a Mediterranean-style diet rich in vegetables, fish, olive oil, and whole foods. Exercising daily, even just 30 minutes of walking counts. Taking your prescribed medications consistently every single day. Managing chronic stress through whatever methods work for you. Getting 7 to 8 hours of quality sleep, and avoiding smoking and excessive alcohol consumption. I had a 72-year-old patient last year with poorly controlled blood pressure and high cholesterol levels. We optimized his medications in partnership with his cardiologist, and he committed to walking 30 minutes every morning and making significant dietary changes. 6 months later, his cardiovascular markers were excellent, and his physical function returned for the first time in over 5 years. He looked at me and said, "Dr. Jocelyn, I genuinely thought I was done. I'm not done." Number 4, get your testosterone levels checked and properly optimized. If they're low, testosterone naturally declines with age. That's a normal part of the aging process. But many men over 70 have levels that are clinically low enough to cause significant symptoms throughout their lives and potentially justify medical treatment. Here's the biology. Testosterone supports so much more than just physical function. It supports libido, energy levels, muscle mass, bone density, mood stability, cognitive function, and yes, physical performance. When testosterone is too low, every single one of these areas suffers noticeably. The key is getting comprehensive, thorough testing, not just a single total testosterone reading. You need total testosterone, free testosterone, estradiol levels, and sex hormone-binding globulin measured together to get the complete picture. If your levels are genuinely low, generally total testosterone below 300 nanograms per deciliter, or low free testosterone even with seemingly normal total testosterone, testosterone replacement therapy can be genuinely life-changing for many men. Clinical studies show that men over 70 who receive appropriate, medically supervised testosterone replacement therapy experience significant improvements in energy, mood, muscle mass, bone density, cognitive clarity, and physical function. Emotionally, having your vitality return after years of gradual decline is profound. Patients consistently tell me it feels like coming back to life after sleepwalking for years. Practically speaking, testosterone replacement comes in several different forms: weekly or bi-weekly injections, daily topical gels, patches, or subcutaneous pellets that last several months. Work closely with a knowledgeable doctor to find what works best for your lifestyle and body. The older concerns about testosterone and heart health or prostate cancer risk have been largely debunked by recent, well-designed research. When properly monitored by a physician, testosterone replacement is safe and beneficial for most men who genuinely need it. I had a 76-year-old patient whose testosterone level was in the bottom 5th percentile for his age. We started carefully monitored replacement therapy. Within just 3 months, his energy returned dramatically. His mood improved in ways his wife noticed immediately. His muscle mass increased, and his physical function came back. He told me with emotion in his voice, "I feel 20 years younger. I didn't realize how bad I felt until I started feeling normal again." Number 3. Use medical tools without shame or embarrassment. Modern medications work remarkably well. One of the biggest barriers preventing men over 70 from getting help is shame or pride about using medication for this particular issue. Let me be absolutely clear about something. There is zero shame in using medications like sildenafil, tadalafil, or other options that support healthy function. These are legitimate medical tools, exactly like blood pressure medication, cholesterol medication, or diabetes medication. Here's the biology. These medications work primarily by increasing blood flow to specific tissues. They don't create some artificial, fake function. They support and enhance your body's own natural mechanisms that may have become less efficient with age or underlying health conditions. At 70 and beyond, nearly every man benefits from some level of medication support, even if they're doing everything else right with lifestyle and health optimization. That's not weakness or failure, that's medical wisdom and self-care. The key is finding the right medication and the right dose that works specifically for your body. Sildenafil is typically taken as needed before activity, works within 30 to 60 minutes, and lasts for 4 to 6 hours. Tadalafil can be taken either daily at a low dose for continuous support or as needed at a higher dose. It lasts up to 36 hours, which many men prefer. There are other options your doctor might recommend based on your specific situation. Clinical studies show that men over 70 who use these medications regularly, whether with a partner or for solo activity, actually maintain better long-term tissue health and better sustained function than men who avoid medication and remain completely inactive. Emotionally, letting go of shame or embarrassment around medication is genuinely liberating. It's a tool. Use it without judgment, just like you'd use reading glasses. Practically speaking, talk honestly with your doctor. Get a prescription. Try it and see how your body responds. Adjust the dose or type as needed based on your experience. I had a 74-year-old patient who refused to consider medication for years, purely out of pride. He thought it meant he was giving up or admitting defeat. Finally, he agreed to try tadalafil. After just a few weeks, he came back and said, "Dr. Jocelyn, I wasted years being stubborn and proud. This works. I wish I'd started 5 years ago." Number 2, stay physically active. The use it or lose it principle is medically real. This might be somewhat uncomfortable to discuss openly, but it's medically true and important. Regular physical activity, whether with a partner or through solo activity, is genuinely essential for maintaining function at any age, but especially beyond 70. Here's the biology. Regular activity maintains consistent blood flow to tissues, keeps nerve pathways active and responsive, supports hormonal signaling throughout your body, and prevents tissue atrophy. When you stop completely for extended periods, tissues gradually lose elasticity, blood vessels become less responsive to signals, and function becomes increasingly difficult to restore over time. Clinical research consistently shows that men who maintain regular activity, ideally 2 to 3 times per week minimum, throughout their lives retain significantly better function in their 70s and 80s compared to men who become completely inactive. This biological principle applies whether you have a partner or not. Solo activity provides exactly the same biological benefits it maintains: tissue health, promotes healthy circulation, and supports continued hormonal function. Emotionally, staying active reinforces the internal belief that you're still vital, still capable, still fully engaged in this important aspect of your health and well-being. Practically speaking, aim for at least twice per week consistently. Use medication support if needed to make activity possible. The goal is consistency and regular engagement, not perfection or performance. I had a 78-year-old patient who'd been completely inactive for 3 years after his wife passed away. We had an honest conversation about the use it or lose it medical principle. He started maintaining regular solo activity with tadalafil support. 6 months later, he started dating again and was genuinely shocked that function returned when he needed it. He said with tears in his eyes, "I thought that the entire part of my life was completely over forever. It's not." Number 1. Prioritize your overall health. Vitality is systemic, not isolated. This is the most important strategy on this entire list, and it's the one that men most often overlook or underestimate. Physical function doesn't exist in isolation. It's a direct reflection and indicator of your overall systemic health. When men over 70 successfully restore function and vitality, they're never just taking a single pill and hoping for magic. They're systematically optimizing everything about their health: sleep, getting 7 to 8 hours per night consistently, addressing sleep apnea if it's present. Nutrition, eating whole, unprocessed foods, adequate protein for muscle maintenance, healthy fats, minimal added sugar. Exercise, daily movement of some kind, plus resistance training at least twice per week to maintain muscle mass. Stress management, regular relaxation practices, maintaining social connections, having purpose and meaning. Mental health, actively addressing depression, anxiety, or isolation with professional help if needed. Medications, taking all prescribed medications consistently every single day, reviewing everything regularly with your doctor. Here's the biology. Every single one of these factors directly affects circulation, hormone production, nervous system function, inflammatory levels, and overall vitality. When you optimize all of them together consistently, the cumulative positive effect is remarkably powerful. Emotionally, taking comprehensive, holistic care of yourself reinforces dignity, self-worth, and the belief that you deserve to feel good. You're not just trying to fix one isolated thing. You're honoring your whole self and your right to quality of life. Practically speaking, this means making your overall health a genuine priority in your daily life, not waiting passively for problems to get progressively worse, being proactive and taking charge. I had an 82-year-old patient who fully embraced this comprehensive approach about a year ago. He worked with his doctors to optimize all his medications. He started walking every single morning. He completely overhauled his diet with his wife's support. He got fitted with a CPAP machine for his sleep apnea. He started testosterone replacement. And he used tadalafil regularly for consistent activity. 1 year later, he told me with genuine amazement, Dr. Jocelyn, I feel better and stronger at 82 than I did at 75. I have more energy, I'm mentally sharper, I'm physically stronger, and yes, everything works the way it should. That's what becomes possible when you completely refuse to accept decline as inevitable. Now, here's the critical mindset shift that changes everything. It's this simple but profound change. Stop asking yourself, am I too old for this? And start asking, what does my body actually need to function well? The men over 70 who succeed in restoring vitality don't accept age as an excuse or an endpoint. They don't give up. They ask fundamentally better questions. What does my cardiovascular system need to function optimally? Are my hormone levels where they should be? Am I using all the medical tools currently available to me? Am I staying physically active consistently? Am I taking comprehensive care of my overall health? When you consciously shift from I'm too old to what can I optimize and improve, absolutely everything changes in your approach. You stop being a passive victim of age and time, and you start being an active, engaged participant in your own health and quality of life. I've had patients in their late 70s and even early 80s successfully restore function they thought was gone forever. The fundamental difference wasn't their chronological age, it was their mindset, their determination, and their willingness to consistently do the work required. Here's your practical action plan starting today. 1. Schedule a comprehensive health assessment with your doctor, full cardiovascular markers, complete hormone panel, thorough medication review. 2. Work systematically to optimize your cardiovascular health, blood pressure, cholesterol levels, blood sugar control, inflammation markers. 3. If your testosterone is clinically low, have an honest discussion with your doctor about whether replacement therapy makes sense for you. 4. Don't let pride or embarrassment keep you from using medication that works. Try sildenafil or tadalafil and see how your body responds. 5. Stay physically active. Aim for at least twice per week consistently, using medication support if that's what makes it possible. 6. Optimize your overall systemic health. Prioritize quality sleep, improve nutrition, regular exercise, effective stress management. 7. Consciously shift your mindset from too old to what can I optimize? Do this consistently and patiently. Give your body 6 months to respond fully. Track your progress honestly along the way. I need you to truly hear and internalize this message. 70 is not the end of vitality. 80 is not the end. Your chronological age doesn't define what's medically possible. Your overall health status and your daily choices define what's possible. I've personally seen men in their 70s and 80s reclaim vitality, function, and confidence they genuinely thought was gone forever. Not through luck or genetics, but through refusing to accept decline as inevitable just because of age. You deserve to feel vital, capable, and confident in your body. And that's genuinely achievable with the right approach. Hit that like button if this video gave you genuine hope that it's not too late for you to improve your health and vitality. Share this video with another man in your life who needs to hear that age doesn't have to mean the automatic end of vitality and quality of life. Subscribe to this channel if you haven't already. I'm here to give you honest, evidence-based strategies that actually work at any age, without the pharmaceutical sales pitches or false promises. And remember this important truth. The men over 70 who are genuinely thriving aren't special or lucky. They're strategic. They refuse to give up on themselves. They consistently did the work. You can too. You absolutely can. It's not too late for you. You're not finished. Small, consistent changes lead to surprisingly big results over time. I'll see you in the next video. Take care of yourself because you're absolutely worth it.